back to my channel. My name is Hanadi and I am an intern doctor. If you've clicked on this video, it probably means that you are going into your surgical rotation, or you have already started and would just like to be more oriented about what to do when you want to approach the operating theater. Now, just to make things very clear, I am not a surgical resident yet, but I've had experience. I have been in the OT multiple times. It's one of my favorite places in the hospital. I want to give you guys the tips and tricks of how to approach it if you are new. So I'm going to be talking about what you can do before going into the OT, during or inside of the operating room, and then after. So first of all, before the procedure takes place, or before you go ahead and get into the OT, it is very important that you know who is the lead surgeon, doctor operating on this case. And of course, you have to go ahead and introduce yourself to the doctor. The second thing you want to do, depending on how much time you have exactly, is that you want to go ahead and look up just a quick review of the anatomy of the area that you are going to be operating on. This will for sure save you some time, because surgeons love to ask us about the anatomy, and although it is something that we have studied like a couple of years back, obviously we tend to forget if we're not being exposed to the anatomy again and again and again. So if you do have some time, just quickly look up the anatomy of the area you are going to be operating on. It might save you, and even if you were not asked, you are going to have a better understanding of what you are looking at. The next thing is that obviously you have to change your clothes. I know that this point might be obvious, but if you are new, it is totally normal for you not to know anything basically. So you do have to change into the hospital scrubs that they provide you, as well as your shoes. And please, in case you are scrubbing in, don't be like me. You need to remove all of your jewelry and make sure it's safe. So either buy a little jewelry pouch or keep it in your bag somewhere safe. Don't keep it in your scrubs, because yeah, I've definitely learned my lesson. I have kept them inside the hospital scrubs and then they have gone to the washing, and let's just say that it's not fun to go to someone for help for that. So yeah, make sure you take off any jewelry, any hand jewelry, if you are going to be scrubbing it. One more thing that a lot of people don't really do before surgery, and I think that it's something that can add to your learning opportunity. You can make sure which patient are you going to operate on, and then you can go and see them in the pre-op area. That is a really good opportunity to take some focused history questions. You can even examine the patient. Honestly, been very helpful. So you can go ahead and definitely do that if you have not been following up with the patient, or even if you know the patient, just go and give them some reassurance. They always appreciate some added kindness. Before starting the procedure, it is also again really interesting to learn about everything that goes on in the operating room. It is a team. You have the team of your nurses, you have the anesthesia team, and then you have the surgical team. So there is so much to learn from being in the operating room. Okay, so you enter the OT, you are lost, it's big, people are busy, they are roaming around, it's like a beehive, and you have no idea where you should stand. You don't even feel like you belong. It's okay. The first thing you want to do is introduce yourself to the circulating nurse. The circulating nurse is the person who is going to be managing everything going on inside of the OT. If you don't exactly know who the circulating nurse is, that is fine. Just ask, or you can literally talk to any nurse. Then we have the scrub nurse. The scrub nurse is basically the nurse who is going to be setting up the instruments and the blue tray that you see. They are also in charge of getting out the doctor's gowns and gloves. So they are the person you want to go for to ask them to take out a gown and gloves for you if you will be scrubbing in. Not forget this point, because usually if medical students want to scrub in for the first time, they will go ahead and do the scrubbing, but they have informed no one about taking out a gown and gloves for them, so they are just standing there awkwardly with water dripping out of their hands. So definitely tell the scrub nurse that you would like some gown and gloves. Also, this video does not include how to scrub or put on sterile gloves, so definitely watch a quick video on that if you are not aware. But I do have some do's and don'ts for you guys after scrubbing in, and these are things that I have learned, you can say the hard way, or they are things that the doctors have told me about. First thing is that after you have applied your gown and gloves, You are sterile. Your mask and your hair cap are not sterile, so you cannot adjust your mask or your hair cap once you have your sterile gloves on. The second thing is that the back of the gown is considered unsterile, so make sure that you are not standing behind someone directly. Just in case they back up and they bump into you, you will have to change your gown and gloves. Also, since your back, as we said, is unsterile, make sure your back is not towards the tray on which the instruments lay upon, because again, if you hit the tray, that is considered you being unsterile, hitting a sterile tray, and you will have a very angry scrub nurse. But they do tend to remind us all the time of our positioning just to make us more aware. Sometimes the doctor would ask for someone to adjust the lamps. Make sure that you do not touch the lamp if they do not have a sterile handle on them. The lamp itself in the surgical room is not sterile, so you cannot be adjusting it with your sterile glove. So obviously once you're sterile, you have your gloves on, you can touch everything blue. So you can either rest your hands on your chest, make sure you don't cross your hands because as we said that the back is unsterile, or you can even put them on anything blue. So for example, once the patient is draped, you can go ahead and rest it on anything that is draped because you are sterile. And if you are not scrubbed in, you are not sterile, do not touch anything blue. You can come close to observe obviously, but just make sure that there is a pretty good distance between you and the sterile field. If you are told to get anything or do something, just double check with your scrub nurse on how to do so, because sometimes the doctor can be too focused that he's not really paying attention to who he's talking to exactly. One more thing to do before you enter the operating room is that please make sure to eat something and to have some water. Being scrubbed in is totally different from just standing outside of the sterile field and observing. When you are scrubbed in, sometimes you can feel hot because of everything that you're wearing, especially if you're wearing lead, if you are in a surgery that requires x-ray, and also because of the bright light. So a mix of all of this, adding with the stress that you must be feeling, you can get a little dizzy and lightheaded. So please make sure to eat something and to have some water beforehand. Just in case you start feeling dizzy or a little bit uneasy inside of the surgery, please make sure to tell your surgeon. It is completely okay to step away from the field. It is completely okay to unscrub, to take everything off and to excuse yourself. That is so much better than fainting in the operating room and then them having to deal with one more patient. So it's totally okay, no one's gonna judge you for that. Just go have a little break, have something sweet, and then come back and you can either scrub back in or observe for the rest of the case. I like to learn from the anesthesiology team, just really like to observe how they prep the medications, how they give the anesthesia. Are they intubating? Are they using an LMA? What are the indications for using this specific anesthesia, and why don't we go for another form of anesthesia? And if you are on your surgical rotation, you can learn a lot from what is going on from the anesthesia team. Just be aware, be observant, and have an open minded to learn from everyone inside of the room. I definitely read the room before asking any question. Definitely ask about the way that they're handling certain instruments, ask about their names, what do they do, and this will just help your knowledge expand so that the next time you go into the operating room and you see the same technique being used again, you know what it is, what it's called, and you know what it is for. With that being said, I just like to give a few more warnings. If the surgeon or the scrub tech is holding something sharp, just beware of your fingers. Don't point or put your fingers in front of the sharp instruments just because you could hurt yourself. And it is another reason of why I like to double glove, just in case, you know, I touch something sharp and it goes through my first set of gloves. I always like to have a second set of gloves underneath for protection. Only do what you are being told to do. So don't go ahead and do something just because you thought it was the right thing to do. Do not make any assumptions. Everything they do is for a reason. So go ahead and ask twice if you want to do something, or just stick to what they are telling you to do. I know that all of this can sound very intimidating and it sounds like you have to think of a million things, but it's really not the case at all once you are in the zone. Talk about the after. Surgery is done, you have sutured everything closed. So what I like to do is to help off with the dressing. So back to where I have mentioned that I have double gloved, so I take off the first pair of gloves. Usually they would be stained with blood or anything like that, so I take off the first pair and then I have a clean second pair of gloves under that, making sure that the dressing obviously is not dirty from any bodily fluid. It is very fun, it's very exciting, and even if you are not particularly interested in a surgical specialty, still such a nice environment for you to experience or to observe. And it is exactly why I wanted to film this video, just to kind of let you guys know about the basics and how I can help out. But that is all I can think about. If you do have any questions, or if any certain situation has happened and you would like to know what else you could have done, or if you have any questions in particular, you can go ahead and leave them in the comments below and I will answer. Let me know if this was helpful for you, and let me know if you are on your surgical rotations, how is it going? Are you interested in surgery? It is something that I would like to know. I love reading the comments that I get and replying back to you guys. That is it for today's video. I hope that you have enjoyed, and I will see you guys in my next one. Bye bye.